I'm sure you're worried about the medications, the injections that are given to you during an IVF stimulated cycle. Hi, I'm Dr. Suvarchala, Scientific Director with Ziva Fertility Centers. The injections that are given during an IVF cycle are for around 8 to 10 days, sometimes extended to 12 days, depending on the response your ovaries gives to these injections. To understand that, you need to first understand the human physiology, what's happening inside your body naturally. Now, your brain is where everything starts. Your ovaries is the end reaction, but your brain is where the whole action begins. The brain has a small part called as hypothalamus, and then it sends a signal to something called as pituitary, all in the same complex. It sends a signal by way of a hormone called as GnRH, gonadotropin releasing hormone. This acts on pituitary, and pituitary releases follicle stimulating hormone that goes with your bloodstream and acts on the ovaries to make eggs grow. All this happens at the beginning of the period cycle. Once the egg begins to grow, on its own also, it releases a hormone called as estrogen. This estrogen helps the egg in maturing, the endometrium in growing, the uterus in preparation for a pregnancy. Then when the egg is maturing, a few eggs are maturing, but only one becomes dominant, and it pulls up all the FSH and it grows. The estrogen gives a signal to the brain to shut off follicle stimulating hormone, because this dominant one has started to release a lot of estrogen. When that happens, the brain shuts off FSH and releases LH, which is luteinizing hormone. This luteinizing hormone makes the egg ovulate. When it ovulates, it comes in the tubes, and that's where fertilization happens. And the ovulated egg, the spot from which it ovulated, releases progesterone, which acts on the endometrium to thicken it, to increase the blood supply. If a pregnancy happens, then the embryo attaches to this lining. If it doesn't, there is a period. Now, to mimic this in an IVF cycle, we give you follicle stimulating hormone from day 2 or day 3 of your period. So it's very similar to your natural physiology, just that we are giving a little higher dose so that we can grow a few more eggs, so that we can make a few more embryos, have a better selection from these embryos, and increase the success rate. Now, when FSH is given after a certain period, if the embryo transfer is planned, estrogen may also be added to this. When the eggs are of the right size, LH is given by way of human chorionic gonadotropin. It is a hormone that mimics LH, luteinizing hormone, and by giving this, the eggs are made to ovulate. However, we need to catch the eggs before they ovulate, because if they ovulate, they will either go into the tube or into the abdominal cavity, which is not good. The whole idea is to catch them before they ovulate. So when you get a HCG injection, which is called as a trigger, before 36 hours we need to collect the eggs. Around 35 to 36, it doesn't mean you can collect it at 24, 25, but between 35 to 36 hours the eggs need to be collected. This is done under anesthesia, and the eggs are collected, mixed with your partner's sperms, embryos are created, and if the endometrial lining is good, then the embryos are transferred back. But there is another issue there. So the endometrial lining is primed with progesterone from the day the eggs are removed. So that is accounted as day 0. From there, for about 3 to 5 days, progesterone is given, and then the embryo is put back into the uterus. Progesterone is continued for the next 14-15 days until the beta HCG to find out if you're pregnant or not is conducted. It's a blood test. So this is what is happening in an IVF, which is very close and similar to a natural physiology cycle. It is mimicking. If the embryo transfer is not performed in this cycle, it's done in another period, then the embryos are frozen, and in the next cycle, all these injections are not given. Estrogen is given, progesterone is added, and then embryos are transferred back at the right time into your uterus to achieve a pregnancy. If you wish to understand more, please feel free to contact us.